Hello, my name is Emma Walter, and this is my 2024 capstone project for Eastern Shore Community College. From an early age, I became very familiar with the term mental illness. At first, I was unaware that mental illness encompassed a lot more than just feeling sad, and I felt sad most of the time. I moved around a lot as a kid, which meant changing schools and houses, and making friends became harder as time went on. I distinctly remember sitting in the library to eat lunch because it was too humiliating to sit at a cafeteria table all by myself, and I was too shy to strike up a conversation with my peers. Technically, I wasn't supposed to have food in there, but I think the librarians felt bad for me. This began my long spiral into therapy, diagnoses, and misdiagnoses, and medications that made my world feel bleak. It wasn't long before I realized just how hard it is to receive proper treatment and understanding for mental illness. With that being said, my project centers around mental illness, including trauma and neurodivergency, and how dire our situation has become. Almost every person has had some experience with these things in their lifetime, and it commonly starts in childhood. Even with so many people experiencing similar things, millions of children spend their time thinking that they are alone and helpless. My hope for this project is to shed some light onto this growing problem in our society. Growing up is hard. During puberty, the changes that occur in the body can be overwhelming and confusing. This, combined with cultural, economic, and social issues such as poverty, gender inequality, violence, displacement, and income struggles, can predispose children to mental health crises. In an article written by the World Health Organization, it states mental health conditions account for a considerable proportion of the global disease burden during adolescence and are the leading cause of disability in young people. Up to 50% of all mental health conditions start before the age of 14 years. Experiencing mental health struggles at an early age can cause adolescents to engage in a multitude of risky behaviors, including drug use, self-harm, and violence. Young girls also tend to experience double the risk of common mental disorders compared to males. Domestic violence and inappropriate and traumatic sexual experiences can also affect young girls and their mental well-being more than males. It is possible and quite common for young children to exhibit early signs of mental health issues, like ADHD, depression, PTSD, and also neurological disabilities like autism. However, even though they can have symptoms, they process and react to it differently than adults or even older children. This means a diagnosis for young children is rare. Toxic stress, defined as prolonged activation of stress response systems in the absence of protective relationships, can affect children for the rest of their lives because of how damaging it is to the brain. This can impair school performance and physical health. It is always better to treat mental health problems and trauma as early as possible, despite the amazing resilience some individuals have in the face of adversity. A trauma theorist named Lenore Terr describes the impact of trauma in children with two types, type 1 and type 2 disorders. Type 1 is used for traumas that happen one time and or briefly. This can mean being attacked by a dog or being separated from your family. Type 2 disorders refer to multiple or lengthy traumas. This can mean being sexually abused for years or bullied relentlessly during middle school. In Tara's discussion of type 2 disorders in children, she mentions responses that parallel those in adults with complex PTSD. Tara argues that for child victims of prolonged and repetitive trauma, in addition to dealing with every trauma experience, they also struggle with the anticipation of injury and trauma. These children use numbing and detachment and cut off defenses that allow the child to feel less intense, to become almost immune to the pain. Repeated use of these defense mechanisms can negatively impact children during their adult years. Without intervention or treatment, children suffering from type 2 disorders may go on to develop adult personality disorders such as dissociative identity disorder and borderline personality disorder. A large part of my project was conducting interviews with professionals who interacted with mental health on a daily basis. Unfortunately, I wasn't able to meet with as many people as I wanted to. I was able to meet with two very important people, and I am very grateful for the opportunity to interview them on something that is very close to my heart. Lori Watts, a school psychologist for 30 years in public schools, and Colleen Forrest, a psychiatric nurse practitioner, both gave me incredible interviews that I will be mentioning today. I gave them both the same interview consisting of 13 questions, but I will be summarizing the interviews just for the sake of time. Both women mentioned that it is extremely important to be talking about mental health in today's world. They both explained that there are high levels of anxiety and depression, even in younger children. They claimed that good mental health is a strong basis for a successful life. Both professionals also brought up the fact that children are often amazingly resilient when faced with complex trauma and mental health conditions, but it doesn't always mean that they're healthy. Resilience can mean still being able to function in school or work, but struggling with meaningful relationships with people and inwards. With enough social support and connection, they believed pretty much any kid could work past any challenges they face. Finally, they both exhibited a desire to see more research and data going into mental health surrounding children, and hope to see more and more children recovering from traumatic events and mental health issues. This is why it is extremely important for children's mental health to be evaluated and treated as early as possible. Luckily, with the internet and the help of psychologists and other mental health care providers, scientists, parents, friends, and loved ones, the stigma around mental health is slowly starting to disappear. Our system isn't perfect, however, and effective, accessible, appropriate mental health care for adolescents will require reinventing our mental health care systems. If you're starting to wonder, well, what should I do? There are millions of easily accessible articles to read about how you can help certain people in your life. For example, you can encourage those who are struggling to exercise regularly, get a good night's sleep, eat healthily and intuitively, and connect socially. It may sound redundant, but the small things can really help those who tend to spiral. As for children, it's extremely important for those in their life, parents, friends, grandparents, caretakers, and siblings, to know the signs and take action when their behavior is changing. If a child is expressing alarming behaviors that might point to a traumatic experience or mental health issues, seeking help as early as possible is best. Raising awareness is the most important. People struggle with mental health and trauma everywhere, even in the small communities on the Eastern Shore. Talking about it is the first step. It may feel awkward and shameful at times, but hearing real-life experiences and even finding some comfort in shared feelings can jumpstart effective treatment. It's easy to stand back and watch, but slowly, together, we could be changing people's lives. Thank you.